Hi, my name's Danielle Wilson and I'm a consultant clinical psychologist working in specialist palliative care in South Tyneside. And I'm going to talk today about the emotional impact of cancer. So for many people, a cancer diagnosis is accompanied by a range of emotions. Anger, sadness, worry, frustration are all really common. It can be as if life was going in a particular direction. You knew where you were going and what you were doing, and then all of a sudden a storm hits. Suddenly, the journey ahead looks quite different as investigations, treatment schedules and clinic appointments take over. And even once treatment ends, the road ahead can look very different to how it did before diagnosis. And some people are no doubt surprised at this point that life doesn't simply pick up from where it left off. So why do people struggle? Part of this might be due to personality. Some people will describe themselves as having always been a bit of a worrier or always been prone to think the worst. But that isn't all it comes down to. You might have heard the phrase, we're all in the same storm, but not necessarily in the same boat. Two people might receive the same cancer diagnosis, perhaps even be at the same stage and have the same treatment approach, but they might have different emotional reactions. In part, how well we cope might come down to the physical impact the disease has on us, such as any side effects you experience or how well your body tolerates the treatment, the amount of social support you have around you, your financial situation, other life events that impact on you either now or in the past, and religious and spiritual beliefs all play a part in how well any of us cope. The vast majority of people who get a cancer diagnosis are going to experience some degree of stress and emotional discomfort, and in part that's simply how our minds have evolved. Our minds work on a better safe than sorry principle, and what that means is that we find it much easier to think the worst about what lies ahead rather than assuming everything will be okay. This is somewhat ironic because well-meaning family and friends might often tell you to just think positive, as if this is something very simple for you to do. It's not. It's not the way that your brain's been built. And many patients buy into this too and think that there might be something wrong with them. A big part of the work that I do with patients is often to help them understand that their emotional responses are completely understandable given the extraordinary situation that they find themselves in. If you find that you're struggling with the emotional impact of a cancer diagnosis, I'm going to share some tips now that might help. First of all, be gentle with yourself. Give yourself permission to feel your feelings. The fact that you might be feeling worried, stressed, anxious or upset right now doesn't mean that there's anything wrong with you. It simply means that you're a human being trying to deal with a very challenging situation. Second of all, think about what you can control in your life right now. Often when we feel stressed, we start to focus on things that concern us, but that we don't actually have a great deal of control or influence over. Think about what you can control right now, even if those things are really small. Perhaps think about who you spend your time with and which activities you invest your time and attention in. Doing this can help things to feel more balanced. So another thing that can help is to think about who and what really matters to you. This can help you tune into your values, which is something that many of us don't think too much about until we encounter something that threatens our ability to connect with those things. A metaphor that can help is the passengers on the bus metaphor, which comes from ACT, or acceptance and commitment therapy. In this metaphor, our values are like the direction that the bus is travelling in. Difficult thoughts and feelings may arise, and these are like unwanted passengers that get on the bus. When this happens, we often want to do one of two things. Either we stop the bus altogether and we try to kick the passengers off, or we let them take the wheel and let the passengers dictate our actions. The difficulty with this is that when we stop the bus, we're not going anywhere all of a sudden. And if we let them take the wheel, we're no longer going in the direction that we want the bus to go in. An alternative is to try to be willing to take the passengers with us as fellow travellers, perhaps relating to them as background noise and setting the direction of the bus ourselves. Another thing that can really help is to try to stay flexible. It is great to have goals, and it's good to continue with the rhythm and routine of everyday life if you feel able to. Try to build in some activities that give you a sense of achievement, connection and enjoyment if you can. But do bear in mind that you may not feel that you're up to the same level of activity every day, and that's okay. Some people tend to have a very fixed plan about how things should go, when things should happen, what they should do, and rules to live by. But this doesn't always work out. It can be a bit like trying to be an oak tree in a storm. The rigidity of the tree makes it more vulnerable to being uprooted or splintered with the force of the winds. As an alternative, think about a palm tree on the Florida coast. The ability of the palm tree to flex and bend whatever the weather helps it to adjust. Being flexible with yourself right now and your expectations of yourself and others can be really helpful too. A final tip is to try and find something that helps you focus on the here and now. Our minds can be very good at mental time travel, but this doesn't always work out well for us. So sometimes we find ourselves rewinding and going over past events that have already happened and that we have no chance of changing. Or we might fast forward into the future and we might think about things that haven't happened yet, that again we can't necessarily control or influence. If this sounds like a trap that you sometimes fall into, it might be helpful to practice something called mindfulness. Mindfulness is a way of trying to focus and connect on what's happening here and now, which sounds like a really simple thing to do, but in actual fact it can be quite tricky because we have minds that are very good at mental time travel. For some people, practicing formal mindfulness exercises can be helpful. These might be exercises where you focus on the breath or the body for an extended period of time. Other people find that there are activities where they are naturally more focused on the present moment. Cooking, gardening, listening to music, exercising can all help us stay present, so try to find something that works for you. If you are interested in practicing some formal mindfulness exercises, do check out the website. You'll find some useful resources there. The good news is that whilst it's common to experience difficult emotional reactions following a cancer diagnosis, you don't have to struggle alone. There is professional support that can help, and if you find that your emotional reactions leave you feeling overwhelmed, if they persist for a long time, or if they interfere with your day-to-day activities, it might be time to check out what support you can access. Your first port of call might be to talk to your specialist nurse. This is somebody who can help you navigate all the different support services that are available to you. Patients who have had their treatment at South Tyneside or Sunderland Royal Hospital can access the Macmillan Counselling Services. These services are staffed by professionals who have expertise in working with people who have had a cancer diagnosis. Other options include Cancer Connections, FACT and Maggie's, which are all charitable organisations that provide psychological support to people who've experienced cancer. Local primary care mental health services are another option. These services provide evidence-based talking therapies such as CBT or cognitive behavioural therapy. You can self-refer to these services or speak to your GP to find out more. And there are also some specialist clinical health psychology services in the region for particular patients, such as those who've had a head and neck cancer diagnosis or those with specialist palliative care needs. The best thing to do if you're feeling unsure about what might be most appropriate for you is to talk to your specialist nurse or reach out to the Macmillan Cancer Support Centre. There will be somebody who can help you figure out the best way forward for you. You can also find more information on the website. Thank you for listening.